good day everyone. I'm John, your moderator for this webinar on the behalf of the organizer company called Conference Panel. I welcome everyone for today's webinar, which is called Stop and Avoid Highly Visible HIPAA Violation on the Internet. So now I would like to introduce our presenter for today, Paul R. Hale. Paul R. Hale's JD is widely recognized for his ability to explain HIPAA rules clearly in plain language. He is an attorney licensed to practice before the Supreme Court of the United States, a graduate of Columbia University Law School and senior counselor of the Missouri Bar with an international practice in HIPAA privacy and security. So now I would like to hand over the conference to our speaker. Over to you, Paul.
Thank you very much, John, and welcome to all. We're going to talk about highly visible HIPAA violations on the Internet. Why do we say that they're highly visible? Now, first of all, of course, they are on the Internet, and you may see them if you are a healthcare provider, for example, looking at the web pages or social media pages of your fellows who are in the same practicing in the same field, competitors, professional competitors, your colleagues. Also, there are a wide variety of marketing consultants and vendors that sell tools for patient engagement and new patient attraction to healthcare providers. So let's look at what we're going to cover. And we're going to start by talking about why this is important. And this is really critical because it explains why what seems to be, to many people, something that's posted on the Internet that really doesn't have anything to do with HIPAA, actually it does. And then we'll go ahead and talk about the HIPAA rules that apply to websites and social media. And then we'll talk about a covered entity social media websites and two simple website safeguards. Those are safeguards to protect the provider. Then we'll talk about the HIPAA rules that cover patient reviews and the reason that these patient reviews are such a concern. And this goes right back to that very first topic. Why is this important? And the reason is that protecting PHI privacy is essential. And the issues, one of the concerns is that folks aren't really aware of how HIPAA defines protected health information. Covered entities, healthcare providers, health plans, and clearinghouses, and their business associates are the organizations that are regulated by HIPAA and must comply with the HIPAA privacy rules. But private citizens or patients or individuals, as the bureaucratic language of the HIPAA rules calls we human beings, individuals are protected by HIPAA. We're not required to comply with HIPAA. And furthermore, patients do not and cannot waive their HIPAA rights by posting their own protected health information. That is another misconception, and it is something that vendors will tell you. It's something that your colleagues may tell you. So HIPAA rules for websites and social media. What websites are subject to the HIPAA rule? Well, it comes from the HIPAA privacy rule. And this is in the section of the HIPAA rules that involve the posting of a notice of privacy practices. Here's the key language. A covered entity that maintains a website, and the HIPAA rules use two words for website. Sometimes you see it spelled as just one, W-E-B-S-I-T-E as the word, but this is the HIPAA rules. Any covered entity that maintains a website that provides information about the covered entity's customers, services, or benefits. So that is the definition of a website that is covered by the HIPAA rules. Here is directly from their website. So I blocked out the names of the hospitals and the name of the facility or the holding organization, but it says, this is on their home page of their Facebook site, that they provide comprehensive inpatient and outpatient services serving the community. The services include cancer, breast health, cardiology, outpatient service. They include general service, surgery, disease management, pediatrics. They will care for patients with compassion and treat patients with dignity. What is that? What is that information on this Facebook site of these hospitals? It's information that explains the covered entity's customer services or benefits. Let's look at the safeguard. Two simple website safeguards for providers. So covered entity's website and social media website, there are simple safeguards. So let's look at the first, safeguard number one. A covered entity that maintains a website that provides information about customer services or benefits must prominently post. Prominent is key here. It was discussed thoroughly in the most recent round of HIPAA audits, the results of which were published in December of 2020. So prominently post the Notice of Privacy Practices on the website and make the Notice of Privacy Practices available electronically through its website. Safeguard number two is before posting any PHI about a patient, get a valid HIPAA authorization. So here's a link to an enforcement action that was highly regarded physical therapy provider in Southern California. And if you go to the link, you can read the entire action, including the settlement payment and the corrective action plan. The complaint was received by OCR, the Office for Civil Rights, that the provider had disclosed PHI impermissibly by posting testimonials. Now, testimonials are really effective, especially video testimonials. However, if you're going to do a testimonial, you've got to have an authorization by the patient to put that up. Now, HIPAA rules covering patient reviews. One of the things that you'll see among vendors is ways to get five-star reviews, encouraging you use their services, get these reviews prominently posted so that when people go looking on the internet to find a good, let's pick on ophthalmologists, they'll see excellent patient review.
Oh, thanks, Paul. It was a wonderful webinar.
Well, I just want to thank everyone for your attendance and your time today, and I want to wish you well in your HIPAA compliance program and in your the operation of your medical practice. So thank you very much.